Welcome back to my channel. Today I'm going to start the guide to the PPSC, the medical officers, women medical officers. It is a complete book which will help you in all the commission exams. It is written by Dr. Junaid Rashid, and I'm also preparing for a job. And this is the book which I started. It is a very good book, so I have decided to make all the lectures from this book. This is the part 1 of the series of the lectures which are from this book. So starting with the hernia. Starting with the definition of the hernia. A hernia, it occurs when an internal organ or the other body part they protrudes through the wall of a muscle or a tissue that normally contains it. Most hernias, they occur within the abdominal cavity, which is between the chest and the hips. The most common form of the hernia are the inguinal hernia, the femoral hernia, the umbilical hernia, and the hiatal or the hiatus hernia. So starting with the inguinal hernia. In men, the inguinal hernia is common, because the inguinal canal, it is the passageway for the spermatic cord or the blood vessels leading to the testicles. In women, the inguinal canal, they contains a round ligament that gives the support for the womb. In an inguinal hernia, the fatty tissue or the part of the intestine that pokes into the groin at the top of the inner thigh. This is the most common hernia which affects the men more often than the females or women. Now starting with the femoral hernia, the fatty tissues or a part of the intestine they protrudes into the groin at the top of the inner thigh. The femoral hernia, they are much less common than the inguinal hernia and mainly affect the older women. The umbilical hernia, the fatty tissues or the part of the intestine they pushes through the abdomen near the navel or the belly button. The hiatal or the hiatus hernia, it is the part of the stomach that pushes up into the chest cavity through an opening in the diaphragm. Diaphragm is the horizontal sheet of the muscle that contains the chest from the abdomen. The other types of the hernia, it includes the incisional hernia, the epigastric hernia, the spigelian hernia, and the diaphragmatic hernia. The incisional hernia, the tissues they protrude through the side of the abdominal scar for a remote abdominal or the pelvic operation. And the epigastric hernia, it is the fatty tissue which protrudes through the abdominal area between the navel and the lower part of the sternum or the breastbone. The spigelian hernia, the intestine that pushes through the abdomen at the site of the abdominal muscle below the navel. And the diaphragmatic hernia, the organs in the abdomen, they moves into the chest through an opening in the diaphragm. The all of the other hernias that occurs, there 75 to 80% are the inguinal or the femoral hernia, 2% are incisional or the ventral hernias, the 3 to 10% they are the umbilical, affects 10 to 20% of the newborns more close to themselves. They close themselves by the 5 years of the age, and 1 to 3% are the other hernias. Now what are the causes of the hernia? The inguinal and the femoral hernias, they are due to the weakened muscles that may have been present since the birth. They are associated with the aging and repeated strains on the abdominal or the groin areas. The strains, they may come from the physical exertion, obesity, pregnancy, the frequent coughing, or the straining on the toilet due to the constipations. Adult, they may get an umbilical hernia by straining the abdominal area, being overweight, having long lasting heavy cough, or the after giving the birth. Mostly the umbilical hernias, they are in the children, and they themselves heals within the 5 years of the age. The cause of the hiatal hernia is not fully understood, but a weakening of the diaphragm with the age or the pressure on the abdomen, they could play a part. So what are the symptoms of the hernias? Symptoms includes a hernia in the abdomen or the groin. They can produce the noticeable lump or the bulge. It is the lump or the bulge that can be pushed back in, or that can disappear when the lying down. Laughing, coughing, crying, and straining during a bowel movement or the physical activity, they may make the lump reappear after it has been pushed in the more push back. The more symptoms of the hernia, it includes the swelling or the bulge in the groin or the scrotum, the increased pain at the site of the bulge, the pain while lifting, the increase in the bulge size over time, a dull aching sensation, a sense of feeling full, or the signs of the bowel obstruction. In the case of the hiatal hernia, there are no bulges on the outside of the body. Instead, the symptoms they may include the heartburn, the indigestion, difficult swallowing, the frequent regurgitation, the bringing the food back up, and the chest pain. The how hernia are diagnosed. Or the on other hand, what are the signs of the hernia? It is usually possible to see or feel a bulge in the area where the hernia has occurred by the physical examination. As part of the male's typical physical examination for the hernia, in guinal hernia, the doctor they feels the area around the testicles and groins while the patient is asked to cough. In some cases, the soft tissues, including like a CT scan, will accurately diagnose the condition. The how hernia is treated. The hernia they usually do not get better on their own, and the surgery they may be the only way to repair them. However, a doctor will recommend the best therapy to address the hernia and may refer to a surgeon. If the surgeon thinks it's necessary to repair the hernia, then the surgeon will tailor the method of the repair that best meets the needs. In the case of the umbilical hernia in a child, the surgery they may be recommended if the hernia is large or it has not healed by the age of 4 to 5 year old. By this time, a child they usually avoid a surgical complication. If an adult has a umbilical hernia, surgery is usually recommended because the condition will not likely to improve on its own and the risk of the complication or the complication is higher. One of the three types of the hernial surgery they can be performed: the open surgery, the laparoscopic surgery. Robotic hernia repair is not very common in Pakistan. In the open surgery, in which a cut is made into the body at the location of the hernia, the protruding tissue is sent back place and the weakened muscle wall is stitched back together. Sometimes a type of the mesh is implanted in the area which provides the extra support. The laparoscopic surgery includes the same type of the repairs. However, instead to cut to the outside of the abdomen or the groin, the tiny incisions they are made by the to allow for the insertions of the surgical tools to complete the procedure. Robotic hernia repair, like the laparoscopic surgery, they uses a laparoscope and is performed with the small incision. With the robotic surgery, the surgeon is seated at the console in the operating room and handles the surgical instruments from the console. While the robotic surgery they can be used for the some small hernias or the weak areas, it can now also be used to reconstruct the abdominal wall. Each type of the surgery has its own advantages and disadvantages. The best approach will decide by the patient surgeon. What can happen if the hernia is not treated? Other than umbilical hernias in the baby, hernia will not disappear on its own. Over time, a hernia they can grow larger and more painful and can develop the complication. The complications of an untreated hernia or the femoral hernia, it includes obstructions, which is incarcerations. The part of the intestine they become the stuck in the inguinal canal, causing the nausea, vomiting, stomach pain, and the painful lump in the groin. The strangulations, the part of the intestine is trapped in the weight that cuts off the blood supply. In such cases, the emergency surgery is necessary to prevent the tissue death. How can the hernia be prevented? The best treatment is the prevention. Maintain the ideal body weight by eating a healthy diet and exercise, enough fruit, eating vegetables and the whole grain to avoid the constipation, and use the correct form while lifting the weights or the heavy objects. Avoid lifting anything that is beyond your ability. See a doctor when one is ill with the persistent cough or sneezing, and do not smoke. A bad habit can lead to the coughing that triggers the hernia. So, what can be expected following the surgical treatment of the hernia? After the surgery, one can be given many instructions like the diet to follow and how to take care of the incisional site, how to take care of to avoid the physical strain, and hernias they may recur regardless of the repair operation. This is because of the inherent tissue weakness or the protracted healing. And the smoking and obesity are also the major risk factors for the hernial front. So this is the QR code. You can go, you can scan this QR code and you can read more on the regarding the hernia. So this is the picture. What are the common types of the hernias? It is the umbilical hernia, which is more common in the kids. It is the inguinal hernia, which is more common in the males. It is the femoral hernia, which is more common in the adult females. Now the next topic, it is basically for the general medicine book, and it has contains the general topics, and topics are random. The choice of the topic is depend upon the chances of being asked in the exam. So the next topic is the thyroid storm management. This is an emergency or the thyroid crisis. We have always heard about it. And how many of you have seen such cases? It is very rare, but if it does occur, it become life threatening. It is rare, and the life-threatening condition is characterized by the severe clinical manifestations of the thyrotoxicosis. In the national survey from the United States and the Japan, the inheritance or the incidence of the thyroid storm was 0.57 to 0.76 and 0.20 per 100,000 persons per year, respectively, in the Japan and America, and 4.8 to 5.6 per 100,000 hospitalization patient per year. A thyroid storm is a rare but severe and potential life-threatening complication of the hyperthyroidism, overactivity of the thyroid gland. It is characterized by a high fever temperature, which is mostly above 40 degrees centigrade or 104 degree Fahrenheit, and fast and often irregular heartbeat and elevated blood pressures and the vomiting. Diarrhea and agitations. Hypertension with the wide pulse pressure, they occurs in the early to the mid crisis, and with the hypotension accompanying the stroke occurs in the late state. Heart failure and the heart attacks, they can occur. The death, they may occur despite the treatment. The most episode, they occurs either in those with the known hyperthyroidism and whose treatment has been stopped for the many years or has become ineffective, or with the untreated mild hyperthyroidism who have developed the intercurrent illness such as the infections. The primary treatment of the thyroid storm is with the inorganic iodine and the antithyroid drugs, which is the propyl thiouracil or the methimazole, to reduce the synthesis and release of the thyroid hormone. Temperature control and intravenous fluid are also mainstay of the management. Beta blockers are often used to reduce the effect of the thyroid hormone. Patients, they often require the admission to the intensive care units. So what are the examinations and test necessary for this disease? The health provider, they can suspect thyrotoxic cases based upon the high systolic blood pressure and the low diastolic blood pressure, and such that there is a wide pulse pressure and a very high heart rate and a history of the hyperthyroidism, and examination of the neck that can lead to the enlargement of the thyroid or the goiter. And the blood test includes the TSH free T4 and T3. Other blood tests, they are need to see the kidney and heart functions. To the treatment of the thyroid storm, it is as it is a life-threatening and requires the emergency treatment. Often the person, they need to be admitted to the ICU, and the treatment includes the supportive measures such as giving the oxygen and fluids in the case of breathing difficulty or dehydration. The treatment, it can include the cooling blankets to return the body temperature to the normal, and the monitoring, they may any excess fluid in the older patients with the heart and kidney disease, and the medication to manage the agitation, and the medicines to slow the heart rate, and the vitamins and the glucose. The final goal of the treatment is to decrease the level of the thyroid hormone in the blood. Sometimes iodine is given in a high dose to try and stun the thyroid. Other drugs, they may include to lower the hormone level in the blood. The beta blocker medicines, they are often given in IV to slow the heart rate and low blood pressure and block the effect of the thyroid hormone excess. The antibiotics, they are given in case of the infection. So the thyroid storm. Number first line is the propranolol, which is a beta blocker, the propyl thiouracil, or the methimazole, or the hydrocortisone. The propranolol is the beta blocker. The propyl thiouracil is the anti-thyroid drug, and the hydrocortisone is the steroids. The second line is the Lugol solutions, or the potassium iodide, or the sodium iodide, the lithium carbonate, and the L-carnitine. The third line, or the supportive treatment, is basically the supportive treatment can be first. It is the repolarizing the electrolyte solutions, the paracetamol for the fever, and the phenobarbital and furosemide or the ACE inhibitor in case of the cardiac failure. The selected cases, they may need the assisted mechanical ventilation in case of the hypoxemia, and the cool mattresses or the cooled polytices in case of the hyperthermia when the body temperature is more than 40 degrees centigrade. Now The coming to the next topic, the topics are very small and they are written in such as you can say that the summary is written. So mostly we will cover the many topics of the medicine for the purpose of to be able to answer the questions which are asked in the general exams like medical officer exams or junior consultants exam. So the next is the malabsorption syndrome. So when a person eats a healthy meal, the body is able to reap the benefits of the vitamins and the minerals. But a condition which is called the malabsorption syndromes, it means that the body is not able to take in the many of the nutrients from the food the one eat. The digestive problem, they can lead to the symptoms such as bloating and the diarrhea. The most important the malabsorption syndromes, they can cause a serious complication, include a higher chances of infections and the bone fracture. What are the causes of the malabsorption? Normally the intestine, they absorbs all the nutrients in the bloodstream through the wall of the small intestines, and digested food works its way through the digestive system, and blood then carries the nutrients such as the calcium and the proteins to the bones, muscles and the organs, and the body expel the leftover through the rectum. And the several medical conditions, they can interfere this process. The following are the infections from the bacteria, viruses or the parasites. They can damage the intestinal wall, and the digestive substance they cannot go through, and one can lose the nutrients through the stool. And some of the other causes of the malabsorption, they include the cystic fibrosis, the chronic pancreatitis and the other diseases that can affect the pancreas, lactose intolerance or the other enzyme related conditions, and the intestinal disorders such as the celiac disease, when the gluten protein from the wheat, barley and the rye, they triggers the immune system and attacks the body. And the severe congested heart failure, they causes the bowel wall to become the swollen with the fluid edema and does not absorb the nutrients well. Some of the causes, they may affect the digestive system. For example, a surgery that removes a part of the small intestine, they means that the less surface area is remaining for the small intestine to absorb the nutrients, and the celiac disease, they may injure the wall of the intestinal tract and making it harder for the nutrients to be absorbed into the bloodstream. And what are the symptoms? The malabsorption, they usually causes abdominal discomfort and including the gas and the bloating, and other symptoms include the frequent diarrhea, the bad smell and the loose stool, and the stools that are light in color and the bulky, and stool that are hard to flush away because they float or stick to the toilet bowl, or the weight loss and the scaly skin rashes, and the chronic diarrhea is very common as a sign of the malabsorption. What are the complications? The complication includes if a body is not getting the vitamins, minerals and other nutrients it needs to stay strong and thrive, and one can face a serious complication. And when it is not treated, malabsorption syndrome, they lead to the greater chances of infections, osteoporosis, which increases the risk of the bone fractures and the slow growth and the weight gain in the children. And the certain nutrients such as the vitamin A and zinc, they are the vital for the healthy immune system and proper growth. If the body is not absorbing these from these form of the minerals and vitamins, health can suffer. And then who is more likely to get this? The children, they had the back stomach flu, they may have the greater chances of the short-term bout of the malabsorption. And one may not need the treatment for a short-term problem. Ongoing malabsorption is more likely if one of the following digestive system or diseases they are present, like celiac diseases, the cystic fibrosis, the Crohn diseases, and the using of the laxatives or the antibiotics for the long time, intestinal surgery, and the traveling to the places known for the intestinal parasites. So how do you diagnose? And the test, the stool test, it is when there is too much fat in the stool, they could mean the malabsorption. The lactose hydrogen breath test, a doctor can see how well the nutrients are being absorbed from and how much of the hydrogen is in the breath, and when you drink milk, sugar or the lactose solution. The sweet test, the studying a small sample of the sweet, they can have diagnose the cystic fibrosis. It is the sweat test. One of the effects of the disease is a lack of the enzyme to properly digest the food. And the biopsy of the small intestine, it is definitely the definitive diagnosis. And the endoscopy. Now the how do you manage it? The Treatment is directed largely towards the management of the underlying causes. Number one is the replacement of the nutrients, electrolytes, fluids. They may be necessary. In severe deficiency, the hospital admission they may be required for the nutritional support and detailed advice for the dietitians. The use of the enteral nutrition by the nasogastric or the other feeding tubes, they may be able to provide sufficient nutritional supplementations. And the tubal placement, they may also be done by the percutaneous endoscopic gastrostomy or the surgical jejunostomy. And patients whose intestinal absorptive surface is severely limited from the disease on the surgery, long-term total parenteral nutrition they may be needed. The pancreatic enzymes, they are the supplemented orally in the pancreatic insufficiency, and dietary modification is important in some conditions. The gluten-free diet in the celiac disease, and lactose avoidance in the lactose intolerance. Antibiotic treatment to treat the small bowel bacterial overgrowth and the cholestyramine or the other bile acid sequestrants, they will help reduce the diarrhea in the bile acid malabsorption. Now moving forward, it is the metabolic syndrome. A metabolic syndrome, it is a group of the 5 conditions that can lead to the heart disease, the diabetic, stroke, and the other health problems. The metabolic syndrome is diagnosed when someone has 3 or the more of these risk factors. Number 1 is the high blood glucose or the sugar levels, the low levels of the HDL cholesterol in the blood, and the high levels of the triglycerides in the blood, and the large waist circumference or the apple-shaped body, and the high blood pressures. The metabolic syndrome, it is associated with the risk of the developing the cardiovascular disease. And in the US, about 25% of all the adult population, they have the metabolic syndrome. It is a portion of increasing with the age, particularly among the racial and ethnic minorities. Insulin resistance, the metabolic syndromes, they are pre-diabetes, are closely related to the one and other and have an overlapping aspects. The syndrome is thought to be caused by the underlying disorders of the energy utilization and the storage. The cause of the syndrome is an area of the ongoing medical research. The key sign of the metabolic syndrome is the central obesity, also known as the visceral male pattern or the apple-shaped adiposity. It is characterized by the adipose tissue accumulation and predominantly around the waist and the trunks. The other signs of the metabolic syndrome includes high blood pressure and the decreased fasting serum HDL cholesterol and elevated fasting serum triglyceride levels, impaired fasting glucose, insulin resistance, and prediabetes. Associated conditions includes the hyperuricemia, fatty liver, progressing to non-alcoholic fatty liver disease, polycystic ovarian syndrome in the women, and erectile dysfunction in the men, and acanthosis nigricans. So we are going to stop our today's video here. See you in the next video. Thank you. Take care. Bye bye.